So just to start, so again, my name is Kristen Pierce. I'm a licensed marriage family therapist and supervisor. And while I am originally from the Northeast, I've been in Texas since 2011, and have worked in various organizations here in the last several years and agencies. And so currently I work at the Greater Austin YMCA. And about a year and a half ago, we launched our mental health program here. And so we offer in person at three of our locations, and coming in January, we should be moving into some additional locations, but we offer in-person and virtual therapy for individuals, couples, and families. We do some groups and workshops at our East Communities, North Austin, and Town Lake locations. And as I mentioned, in the first quarter of next year, we'll be at our Northwest location, in our Hayes Communities location, with the goal and the intention of offering in-person services in all 7 of our locations by the end of 2025. And so, but I'm going to be mindful of time. And so I was looking in the chat, and I can see a lot of you yourself work in this space. So a lot of the information that I have might be known to you already. So my apologies for that, but I'm hoping that I can kind of just share a snapshot of kind of what's available and how to manage some of these things. And at some point later in the hour or hour and a half, I'm happy to answer any questions everybody has. So this is kind of just sort of the table of contents and kind of what's going to be included in this. And like I said, you can feel free to interrupt me, I guess, and put a question in the chat. I'm happy to answer questions as I go. But essentially, you know, this sort of the makeup of the overall kind of options for mental health in Austin, as in many places, sort of you've got inpatient hospitals, you've got nonprofit mental health organizations or agencies, you've got individual and group private practices, and you've got online mental health counseling offerings. And so I have the average cost for counseling in Austin is about $120 to $180 per hour. And that might be high or low, depending on where you are. I mean, that's sort of like a mid-range. I think some organizations offer it for free, but usually when you have free services, there's usually a long waiting list, or you're kind of navigating insurance. If not, if it was grant funded, so you have to meet the criteria of whatever the grant is. Other times there are organizations that, you know, you're going to pay $250 an hour for a private practitioner in some context. So the range is bigger than what's on here, but that was kind of like more of the average that I saw as I've kind of been researching this as we've been working on our program here at the Y. So just some hospital systems like these are a snapshot of some of the, and I'm sorry, I keep getting these things out on my screen, but some of the larger hospital systems here that offer either inpatient, or they offer partial hospitalization programs or intensive outpatient programs, or some combination of all 3 of those things. And oops, sorry, skipped ahead. And, you know, many of you either work for some of these organizations or have referred people to some of these organizations. But I guess my comment I'll address, if you're kind of a consumer and you don't work in this space and you have a family member that is having some kind of acute mental health crisis that requires hospitalization, these would be the sort of first line. I guess I would sort of encourage people to seek out, depending on, you know, whether or not it's a child or an adolescent or an adult. And all of these institutions accept health insurance, and, you know, there's a system and a process for all of that. But you know, again, if you've got some family member that's not safe, suicidal, or in some way not able to keep themselves or others safe, or struggling with something that you know, is life-threatening from a mental health perspective, like these would be the systems that you would be seeking out. Then there's a whole host of nonprofits that offer some kind of mental health counseling. And these are just a snapshot of some of the larger ones in the community. And certainly all of these organizations do incredible work and offer some array of therapeutic services. For most of them offer for across the lifespan. Some, like Austin Child Guidance Center, or just for, minors, and LifeWorks is generally for youth and adolescents, or young adults, excuse me. But many of these, again, anyone of any age can access services here. Now, again, some will have waiting lists. Communities and Schools and Vita Clinic are primary school-based organizations. Some offer services specifically for veterans, some do not. So I think, again, there is unfortunately some work to be done, or some research to be done, if this is a space that you're not used to navigating, if you don't really know anything about how mental health works or where to go. But this group here is certainly a good starting point, and for the vast majority of people should be able to get good service or their needs met with one of these nonprofit mental health organizations in town. Again, some of them, in terms of cost and waiting lists and weekend hours and accessibility, it varies. And to be honest, if there are fewer than there should be, in my opinion, organizations that offer weekend and evening availability, if that's what people need. But not all, but some. And so I think it's just something that, depending on your specific needs, kind of, how you navigate those things, you kind of just have to sort of contact them. A lot of times the information is available on their website. Sometimes the websites are kind of difficult to navigate and you kind of can't get everything that you need, but certainly always call. Then there's sort of the individual and group private practices in Austin, of which there are many. These 5 that are on here are just some of the larger ones that stood out, but there are many, many more than this. And again, some of them are great. But this is, these are, though they might have names and titles that make them seem like they're a nonprofit or make them seem like they're an agency, these are generally kind of just often large private practices. And so, their fees are likely going to be higher. They may or may not accept insurance. Often they have multiple therapists who set their own rates. So, it's depending on who you work with, their level of experience, that may have a lot to do with what the fees are. And I would say that, with these kind of large private practices, some of them, it's difficult, I think, in terms of some people like, well, how do I know that I'm going to get the same level of service with any person that I select? And the short answer is, there's no way to know that just from looking at it. You kind of have to gauge based on experience, based on licensure. And then, often if they offer like a free 15-minute or 30-minute consultation where you can interact with the therapist before you kind of commit and get a sense for how they work and get a sense for how they operate, I encourage people to do that all the time. I think that fit with a therapist is a lot like, if you have a medical doctor that you somehow don't jive with, or if you have, a roommate or a coworker, you kind of have to get a sense for them before you kind of commit to something. It's often very individualized. People have different theoretical orientations. They have different personalities and ways that they work. And so sometimes you have to kind of shop around a little bit until you find the individual therapist that feels like the best fit for you and whatever your needs are, or whatever the needs are of your family member. So then there's all online mental health counseling. So organizations like BetterHelp and Talkspace, and there are more that are popping up. I personally haven't really engaged with any of these directly myself, so I can't speak from personal knowledge about kind of how well they do or don't work. What I'll say about them is that I think many of them were created by very well-meaning mental health practitioners or people who really care about this work and really care about making it accessible to as many people as possible with the fewest number of barriers as possible. However, those folks, in order to create organizations like these that are kind of national and that are kind of, people can access all over the country or certainly all over the world in some instances, usually they sell their ideas to private equity firms or other financial institutions that have the financial backing to expand them and to create the infrastructure that would allow them to operate on these sort of very large scales. And so what that means is that you've taken someone who's a mental health practitioner who has a heart for this work, and you've given it to people who are finance people, right? Who have board of directors or shareholders and who care about the bottom line, which doesn't mean that they don't care about people also. It just means that in many instances, their primary concern, right, is their return on investment. And so you end up with systems that are designed to be something that where they get the return on their investment, and it may not necessarily be optimal from a mental health perspective, which is why there are some class action lawsuits against some of these online mental health counseling entities for confidentiality violations, for discrimination violations, for other kinds of violations, because in many instances, right, these entities, these financial institutions are hiring people with expertise in mental health, but there's a mandate or there's a requirement that they have to, that the revenue has to be X, that they need to be, seeing X number of clients. Again, they're really concerned with their bottom line and making sure that their shareholders are getting a return on their investment. So what I would say kind of generally, without any specifics about any specific one of these entities, is just to be mindful of that, to know that some people, I think, use these and have a very good experience, and some people use these services and don't. Personally, I question kind of like, how do they manage their, how do they ensure quality across the board with so many people that are providing the services with various levels of experience, licensure, and I don't know, various levels of training. So again, there may be an explanation, or it might be amazing. So this is not an indictment of all online mental health counseling platforms. This is just me saying that understand that underlying the service is a financial institution that's primary concern is getting a return on their investment. And so they are likely creating systems and standards that, while there's a mental health benefit because this is the business that they're in, that the primary concern is making sure that they're meeting their financial targets. So kind of, how do I find a therapist? Google is the #1 vehicle by which most people find therapists. So if you are, certainly if you're a practitioner, you want to make sure that your practice or your entity has good search engine optimization, because that's the way most people find you. If you are a consumer and looking for someone, it can feel really overwhelming. But that's the number one way that people find a therapist. Psychology Today, and there's other entities kind of like that, but Psychology Today is a big, it's a site that has sort of, you can search by anywhere, any state in the country. You can search by who takes what insurance, you can search by licensure. And so that's a popular vehicle by which people go on and they search for therapists in their community. And there's, you can define the search by, you can get really granular with people who do, whatever it is that you're seeking. Then this is Melanin and Mental Health. This is more of kind of like an affinity-based search for mental health professionals. So if you're looking for a person of color as a therapist, like, this is one site, again, and there are others. This is definitely not an exhaustive list that allows people to search based on affinity. And so I just wanted to share these three. Like I said, there are plenty of others, but Google is the #1 means by which people search. And so, like I said, if you are an organization or a private practitioner or whatever, you want to make sure that your search engine optimization is sort of working for you. because especially in a community like Austin, there's a million options. And so, if you're kind of on the 12th page, it's not likely that people will find you very easily. And so here are just a couple of really common questions that I get, and that I'm sure that any other person on this call that is a mental health professional get. What do the different licenses mean? So like I said, I'm a licensed marriage and family therapist. There are licensed master social workers, licensed clinical social workers, licensed professional counselors. There's a lot of us. And I think what I would say when people ask me is, in general, we're all working towards the same ends, which is to help people to feel better, right? To help people feel unstuck, to help reduce whatever distress people are experiencing. The different licenses are essentially kind of like theoretical orientation. So as a marriage and family therapist, my license or my training is based in systems theory, which sees causality and kind of as circular, right? Circular causality, meaning that you can interrupt the system anywhere and change it. I think that professional counseling and social work is a little bit more linear in terms of its causality, and it's more of kind of an if then, or kind of in terms of how they think about what causes the distress and how to interrupt it or how to address it. I mean, and that's a really simplistic, basic way to explain it. I think social work tends to be rooted in more kind of case management and initially, and more kind of a holistic, a more humanistic approach. But I think family therapy and professional counseling also has some of those components, right? So again, I think mostly we're all wanting to support individuals and families to feel better and to be unstuck and to have more joy in their lives. What's the difference between counseling and coaching? I get that question a lot. So coaching is present and forward-looking. So if you're doing coaching, you're not talking about anybody's childhood, you're not digging into past trauma, you're not doing past trauma work, you're not doing any of those kinds of things. Whereas mental health counseling can address all of those things. So it can address present and forward things as well as past things, more traumatic things, more things that maybe derive from your childhood or derive from earlier ruptures or experiences that you have in your life that are now affecting how you function in your present life. Another thing is like coaching is unregulated. So while there's a lot of certifications for coaching, and some of them have improved certainly over the years, and I think some are kind of considered gold standards in the coaching space, there is no license for coaching. Coaching is not regulated in the way that counseling is regulated. So and so just be mindful that anyone can call themselves a coach. And so if you are seeking out coaching, any kind of coaching, professional coaching, relationship coaching, whatever, just really do your homework and make sure that you're vetting the people appropriately, because there isn't an overarching entity like there is in mental health counseling. So there's no regulation in coaching. Very often you might find someone who is a licensed mental health provider as well as a coach. And I think that, people who do those things combined are kind of a safer bet, just because that there is regulations around the mental health piece, certainly. And so that they are, they have the training as part of generally as part of their mental health training, whatever that is, that like makes them a legitimate coach. But for people who are just coaches, I would just encourage people, and there are some great ones out there, but just I encourage people to do their research and make sure that they have the appropriate training or certifications or whatever it is to really kind of be a good use of your time and money. How do I know if I'm receiving good service? I think part of that is you kind of have to, my rule of thumb, and this is a completely subjective and personal statement. My rule of thumb for therapy certainly is if you go to therapy and after the second session, you're still kind of having to give context and background information, and you're still feeling like you're still deeply assessing, and you're not really feeling like you're you're giving all the information, but you're maybe not receiving any, even small nuggets that are helpful to you. To me, that's kind of a red flag. Like, you shouldn't be 3 or 4 sessions in and still explaining and still providing context and still, right? By then, there should be some communication, action skills, something where that feels like it's helpful to you. I think that, again, finding the right fit and making sure that you're working with somebody that, even if they don't understand every nook and cranny of your experience, that they can identify something from what you've shared that can be used to assist you in some way, some kind of resource, some kind of strategy, whether it's just a different way of thinking, maybe it's some kind of wellness thing that helps you to regulate breathing, your emotions, something. There should be something that they can give you within relatively short order, even if they don't have a full understanding of all of the reasons that you've come into therapy, or every piece of it that is helpful to you. I feel like compassion is important, and validation is important, and but those are baseline things that, in my opinion, are that should come kind of session one, right? That's not having somebody who kind of is just supportive is important in therapy, but it should be more than that. Like, you need to be leaving with more than what you came in with, if, as it were. I think also, making sure that you're identifying that people are ethical, that they're not, eating lunch during your appointment. They're not giving you personal information about their own experiences during appointments. They're not doing anything that makes you in any way feel uncomfortable. Or if you have to ask yourself, is this normal? Or it's like, should it be like this? Then that's kind of a red flag. And I would sort of be asking more questions. Is more expensive therapy better? The short answer is no. There are practitioners out there that, as a result of their personal values or for whatever reason, like, they are not going to ever be sort of at the top of the food chain in terms of what they charge, because they have some value that they don't want to. It doesn't mean that you're not going to get fantastic service. I think some people charge more because they can, and the therapy market, there is a if the market will bear it, people will charge it, right? If people are willing to pay it, there'll be some that will charge what people are willing to pay. Having said that, and I don't mean to mean that fees are nefarious or that people have negative intention. We spend a lot of money to get the education to do this work. Generally speaking, therapy, nobody becomes a therapist to get rich, or very few people, right? And so people do need to make a living, and I certainly support people that set up fees that allow them to do that. I just think that it doesn't necessarily mean that you're getting the best service. Sometimes you might work in an agency where you're being seen for free, and you're working with somebody who's fantastic. And so I think this is another reason why fit becomes super important, and doing those free consultations to get a sense for the person before you commit. All of these things are really important, because it's not about, sometimes people have more training, so they charge more, they've got more education and they charge more. And, again, they've invested in their education and it makes sense. It doesn't mean that that person is going to be a better fit for you than somebody who maybe has less certifications, less letters after their name, but, is really good at what they do. I personally believe that good therapy is sort of a combination of art and science. There are certain things, obviously, we all learn in our training, but I think that there are some components of this work some people just have that can't be taught. And certainly all the research suggests that it's not a particular theory or model that gets the best outcomes. It's that therapeutic relationship. And so regardless of what model or methods that you're using. So again, I feel like what's most important is that you feel comfortable with the individual and you feel like you're really making progress. And the other thing is, like, therapy is supposed to end. It should have an end date. If you've been working with somebody with the same goal in mind, if you've been working with someone for years and years and with no interruptions and no breaks, to me, that's also a red flag, because the design is for us to support you to meet your clinical goal. And so you can stop coming to therapy, right? That's really the primary goal, whether it's individual therapy, couples therapy, family therapy, whatever. I often ask clients, like, how will you know when you don't need to come see me anymore? what's going to be different in your life, how you're going to feel when you know that you don't need to come back. Because that's what we're working towards, whatever that is, whatever the answer that they give me, like that's our goal, because I want you to not have to come see me anymore for this, whatever this issue is. If something goes up, if some other issue comes up at some other point, of course, you're always welcome to come back and we can focus on something else. But if you're bringing whatever this clinical goal is in today, how will you know when we've solved it, when you've solved it, when it's been resolved, or when you feel good enough that you don't need to come see me anymore? And that, so I think that sometimes I'll have people who will say, yeah, I've seen the same therapist for 3 years. Like, that's interesting, and kind of like how many, and eventually you kind of get the sense that it's the same issue or it's the same goal, or they haven't really, and to me, I feel like that's a little bit of a concern, because to me, that means that either the therapist hasn't kind of set up clinical goals, something that you're working towards. Because if you're not working towards something specific, then you don't know, there's no end point. And the design for therapy is not for people to be doing it consecutively forever.